I will not say that African students are affected more, but compared to others whose families are in the United States, they are homesick. They feel isolated. For some of the students with whom I spoke, the first year on campus, change of culture, they don't have any friends. They have a sense of isolation, and some of them are even depressed. And then with the COVID-19, that issue has affected even more African international students in the United States on campuses.
And very quickly, Professor, what should parents tell their children when they're sending them abroad? What are the precautionary things that they need to make sure these students are aware of? Because, like you said, the cultural differences and other issues arise.
Yeah, but I think the parents should be aware, and it's not, they don't, they may not know what is happening on campuses when it comes to that. The most important thing is to be aware and then suggest to the students, to the children, that, this is part of the issue, and then be educated, the parents themselves, and also somehow educate the children. And the children should be, because they will be living here, they should be more aware of that than the parents.
Well, much as they might be aware, how should they get help? Where should they look for help to be able to kind of stabilize their minds and understand they're in a different culture, they are facing different kinds of things, and we want them to be healthy, to be able to complete their studies? Yeah,
this is the responsibility of the universities. We know the mental health issue is a serious issue for all the students, but universities should cater in a particular way those international students, because, like I said, they're homesick and they feel isolated in the first year, and with all the COVID and many other issues, they are more affected than those who have at least the presence of their respective families.
You mentioned COVID, and we saw a spike in mental health issues right after COVID pandemic hit, the world. How much of these mental health issues has to do with that COVID-19 pandemic?
COVID affected everyone, and sometimes adults or professors, sometimes when students are talking about mental health issues, we don't always understand. We did not experience COVID when we were going to school. COVID destroyed many things in the society, the isolation processes, all of them, of course, affected more the students who are many of them are teenagers, first-year students. And then I think that COVID really changed the patterns, the behaviors, the reactions, the interaction among human beings. And then I think that we have not recovered yet from what COVID has done as effects on the communities in universities and everywhere.
What can you tell us from your own university experience with the students studying there? What kind of concerns did they raise during this period of time?
Yeah, that's a good question. I was expecting that question. Yes, we had several meetings at Lincoln University in Pennsylvania, and then I can say it. Some of the professors seem not to be sensitive enough to the students' position about mental health issues. And then was somehow under the leadership of the president, Dr. Brenda Allen. And then, we had several meetings, and we understood that we have somehow to support the students in this difficult moment, because even us, we've been affected, and then we can imagine how it can be more impactful on the students. So that's a conversation we had, and then we're doing something in order to try and cater to the needs of the student.
And when you say that, what exactly? Is it counseling? Is it seeing doctors? What happened to?
Yeah, so for instance, at Lincoln University, there is like a professors committee, and there are counselors and people who can be there for the student. At the same time, professors with students, we are having this conversation, and then we think that the most important thing to do before any other thing is to promote a sense of community, so that those who are adults in a leadership position can be there for the students who need to have a sense of belonging to a community that cares about them. So this is what we are doing under the leadership of Dr. Allen at Lincoln University.
Professor, thank you very much for your insight and all that information that we just had. Professor Gnaka Lagoke is with the African Studies at Lincoln University in Pennsylvania.